Hello friends, today I will share a few words about polycystic ovary, which is one of the most important causes of infertility right now. Polycystic ovary or polycystic ovary syndrome is basically a disease of endocrine glands, which is one of the commonest endocrinal problems right now in adolescent age group and in reproductive age group also. Usually affects 10% of the total populations. And the commonest presentation is anovulation, when the patient presents with absence of menstruation. Many times I receive calls from my patient that the patient is suffering from amenorrhea in the reproductive age group or married life, but they are not having pregnancy positive. So the patient calls here and there and calls her doctor that, "Doctor, I'm not pregnant, though my period has been stopped. What is the reason? I'm so much afraid." So basically the reason behind that may be lots like hypothyroidism, hyperprolactinemia, but one of the commonest causes anovulation, which is due to polycystic ovary. Now, there are variety of factors for polycystic ovary like anxiety, obesity. Genetic factors is also very much responsible, but it is enigmatic. It is not 100% foolproof for that, as because we are getting lean PCOS also, which is very much hard to tackle. And whenever the patient comes in adolescent group, they are suffering from absence of menstruation or irregular menstruation. When the patient comes after some day, when they get married, the patient is suffering from infertility. So according to their age, their symptoms changes, and basically the need for the doctor's advice changes. Regarding treatment, in a nutshell, regarding treatment is absence of consumption of junk foods, daily lifestyle changes, that means walking, absence of stress-free life, which is quite impossible right now. At least walking, weight reduction, avoidance of consumptions of carbohydrate-rich diet, that is junk foods, and everything which is spicy and jammed foods, and exercise, which is very common. And regarding drugs, there are much more common examples like glyphosate or metformin. Glyphosate is a trade name. Anyhow, it is metformin, myoinositol, dichloroacetal combination. For ovulation induction, there is clomiphene, letrozole, etc. These kind of drugs may be given. Ultimately, if there is associated problems, that is husband's count is less or like that, then we should go for IUI and lastly IVF. But PCOS, in the treatment of PCOS, there is very much importance is weight reduction and lifestyle changes. Because in at least 20 to 30% cases of infertility, we see polycystic ovary. But reminding you one more thing is that PCO is not a diagnosis by ultrasonography itself. By ultrasonography, we cannot say the patient is suffering from PCO, because in which date the ultrasonography has been done is very important. If you do an 13-14 days, day 13 or day 14 days ultrasonography by transabdominal method, and you are declaring the patient as a polycystic ovary, it's not right. We have to do the AMH, we have to do the day 2 FSH, LH, we have to do PP insulin, etc. These kind of blood tests are also important, and we have to find out what is the main cause of anovulation, whether it is hypothyroidism or hyperprolactinemia, etc. Those factors are also excluded. And in a nutshell, those patients who are not suffering from medical treatment will go for a surgical operation, that is microsurgery by ovarian drilling or like that. And IVF is the last resort for this kind of patients for suffering from infertility. So that's all in a nutshell for polycystic. Thank you.